But let's turn CPR to the side for the moment and talk about defibrillation. And I want to share with you some of the important concepts around who we defibrillate and why we defibrillate. And by defibrillation, I mean delivering an electric shock using a defibrillator. Now, it turns out not all cardiac arrests are the same. There are different heart rhythms that lead to cardiac arrest. One of them, which I shared with you briefly at the start of this lecture, is ventricular fibrillation. That's what it looks like. This is a chaotic heart rhythm where it looks like electrical noise. Another rhythm is called ventricular tachycardia. That's where the heart rhythm is going very, very, very fast. So these two rhythms are known as shockable rhythms. If a healthcare provider comes across a patient and discovers they are in either ventricular fibrillation or ventricular tachycardia, they need a shock. They need defibrillation. And this indeed is one of the key teaching points in ACLS, or Advanced Cardiac Life Support, the notion that you shock VF or VT, these patients in these heart rhythms. Now, those aren't the only heart rhythms of cardiac arrest. You could also have something called PEA, or pulseless electrical activity. PEA is a funny rhythm in that it can often look normal. If I just handed a physician or a nurse this heart rhythm strip, they wouldn't know if the patient was in cardiac arrest or not. It can look normal. But in cardiac arrest, there's no blood flow, despite the electrical rhythm looking normal. There's also a well-known heart rhythm called asystole. This is known in the popular sphere as flatlining. You may have heard this in movies or TV shows. Someone goes flatline. That means there's no electrical activity at all. Now, it turns out these two heart rhythms are not shockable. So using a defibrillator is not helpful if someone has PE or asystole. It's only helpful if you have a shockable rhythm like VF or VT. So I want to introduce this to point out that this is where it gets sophisticated. If you're going to use a defibrillator, you have to know which is which. I should say that is if you're going to use a manual defibrillator. It turns out automatic defibrillators, the ones in airports, gyms, and malls, can automatically identify which of these four rhythms a patient is in. These patients that need a defibrillation, an AED, will shock automatically, or if you're a healthcare provider and you see this rhythm, you know to give a shock. These rhythms do not need a shock. So with this one slide, I've taught you one of the most fundamentally important things about using defibrillators, the identification of the right rhythm that needs a shock or does not need a shock. Now it turns out VF and VT are very common for cardiac arrests that occur in the home or in public places. So that's why defibrillators are that important, because many patients who collapse suddenly are in either VFib or VTAC, I should say ventricular fibrillation or ventricular tachycardia. That's the reason for placing defibrillators in public places. In contrast, PA and asystole are less common in the public sphere, but much more common among hospitalized patients. So if someone collapses in the hospital, they may have PA or asystole, and that's more typical, and a defibrillator is less helpful when used in the hospital setting. So AEDs are crucial to save lives, and there's been a lot of work looking at this. However, finding them can be difficult. If you think about it, how would you know where the nearest AED is if your life depended on it, or the life of a loved one? There's no formal system. Now, an exception that proves the rule, you've often looked perhaps on an airport map, and this is not a real map, but a conceptualized map of an airport and airport terminals, and you'll often see markings on a map at an airport showing where AEDs are located. That can be very helpful. However, let's say you're in the lobby of a building and you see someone collapse. How do you know where to find the local AED? This is a big problem because you don't have very much time. There have been a number of recent exciting projects to try to figure out where AEDs are. Some of them have harnessed what we call social media, things like Twitter and other sort of internet-based means to find AEDs and create crowdsourced maps of where AEDs are located. I'll be honest, I don't pretend to understand social media. I'm getting a little too old for such things, but I can tell you that it's an incredibly powerful tool, and it may very well help the public health surrounding cardiac arrest. In Philadelphia, one such project was undertaken with some great success, and I want to now introduce you to Dr. Raina Merchant, who really led this project in Philadelphia, and she'll share with us a little bit on the notion of social media and AEDs.
Hi, my name is Dr. Raina Merchant, and I'm an emergency medicine physician at the University of Pennsylvania. I'm going to share very briefly with you some information about a life-saving device which you could use in the event of a cardiac arrest. So this device is the Automated External Defibrillator, or AED. So AEDs can significantly improve survival when coupled with CPR from less than 2% to 50%. So this is in cases when somebody stops breathing and no longer has a pulse. These devices are really easy to use, and there's data that's shown that these can be used even by people as young as 6th graders. They're located in public places all across the world, in places like grocery stores, supermarkets, government buildings, etc. And they're very simple to use. When you open the device, it'll start talking to you and provide both visual and audible instructions. There are about 1 million of these located across the US, and the big challenge, however, is that nobody knows exactly where all of them are located. So we've been using some new technologies, social media, along with mobile media and crowdsourcing, to find these devices and put them in a database so they